Ladies and gentlemen, welcome to the official opening of Swee Hock School of Public Health's new premises at Tahir Foundation Building. Please join me to welcome our guest of honor today, Dr. Margaret Chan, Director General, the World Health Organization, and our special guest, Amy Kaur, Ministry of State, Ministry of Health, and Ministry of Manpower.
Again, a very warm welcome to all of you. My name is Wee Ming, and I'm a PhD student at the School of Public Health.
And I'm Pek Hoon. I'm also pursuing my PhD at the school. I was a recent graduate of the Masters of Public Health program, class of 2014. We are both very delighted and honored to be part of this momentous event.
On behalf of the school, we would like to extend a warm welcome to our distinguished guests. To the Guest of Honour, Dr. Margaret Chan, Director General of the World Health Organization. Dr. Amy Kaur, Senior Minister of State, Ministry of Health and Ministry of Manpower. Mr. Wong Nit Leong, Chairman of the NUS Board of Trustees. Professor Swee Hock, esteemed NUS alumnus, philanthropist, generous donor, and the benefactor of the school. The Professor Tan Cho Chuan, NUS President and Chairman of the NUHS Board. And finally, to all of you who are here to join us today.
You know, Wee Ming, this is indeed a special occasion. Not only does the school now have more space to accommodate the expanding faculty and student cohort, it's the very first time all the different labs, offices, and divisions are housed under one roof, just as how a family should be.
That's right. The school started only as a department in 1948. And you might not know that before the move to this building, many of the operations of the school were actually at different locations. So some of them could be outside of campus, which might make working together a little bit challenging. As we celebrate the official opening of the school's new premises, it is my pleasure to invite the founding dean of our school, Professor Chia Kee Seng, to deliver his welcome address.
Our guest of honor and distinguished alumni, Dr. Margaret Chan, Dr. Amy Kaur, Senior Minister of State, Ministry of Health and Ministry of Manpower, Professor Swee Hock, our school's generous donor and benefactor, Mr. Wong Nit Leong, Chairman NUS Board of Trustees, Professor Tan Cho Chuan, NUS President and Chairman NUHS Board, distinguished guests, alumni, friends, and colleagues. Good morning to all. Thank you for joining us at today's official opening of our school's new premise. My colleagues and I are deeply touched by your support. We have more than 700 people attending this morning's simple ceremony. There are 300 of you here. The others are throughout this building watching a live webcast of this event. I hope Murphy's Law is taking a break this morning and that they can still appreciate this morning's proceedings. Since my NUS bosses are here, I will shamelessly declare that I'm a born academic. Academics are terrible at giving opening addresses. They are better at giving lectures and with slides. The Swee Hock School of Public Health was launched in 2011 by our Minister of Health, Mr. Gan Kim Yong. Very early in its development, the school entered into a strategic partnership with the London School of Hygiene and Tropical Medicine. We are very glad that Professor Peter Piot, Director of the London School, is here with us this morning. The school began with a very clear mission of turning discovery into healthier communities. we strongly believe that we should not only be academically excellent, but that our research and education must also influence public health programs and policies to improve the health of our communities. Let me take this opportunity to share with you 3 examples of how we have attempted to turn discovery into healthier communities. The first area is in the projection of disease burden. Together with his modeling and simulation team, Dr. Alex Cook adopted a fresh approach in disease burden projection. His individual-based simulation model, unlike the traditional group-based approach, factors in not only aging, but also obesity trends, lifestyle, and even the genetic profile of Singaporeans. In 2010, there were 350,000 diabetics in Singapore. Alex and his team estimated that by 2020, Singapore will be home to 500,000 diabetics, and that this number would rise to 1 million by around 2040, 2050. This is the population pyramid of Singapore in 2010. The black core shows the diabetics among the working population. Dr. Joanne Yoon's team estimated that this 180,000 diabetics in the working population cost the Singapore economy more than $1 billion, both from direct medical costs as well as through absenteeism and productivity losses. This disease burden and economic cost projection have offered policymakers a better understanding of the magnitude and impact of Singapore's growing chronic disease burden and help inform MOH Healthy Living Master Plan. This master plan is a major paradigm shift in health promotion. It moves beyond mere educational campaigns to bring together multiple stakeholders to work towards making healthy living natural and effortless. The school has also contributed to the nation's workplace safety and health policies. As you know, the current model of care for workers' health and safety is fragmented at all levels, at a government level, employers, and workers. Health promotion and chronic disease management was hardly the focus for the Ministry of Manpower. Most employers do not recognize the importance of integrating workplace safety and health. Workers were more interested in going home with their limbs intact rather than in diabetes and hypertension prevention. Dr. Chia Sin Eng led a team consisting of colleagues from our NUS Business School as well as RAN Health. They studied the workplace safety and health systems of 30 companies, surveying over 9,000 subjects, representing top and middle management, supervisors, and workers. Following the study, they proposed total workplace safety and health as a new model of care for the working population's health and safety. The proposal was presented at last year's parliamentary budget debate and subsequently launched in May. Dr. Amy Kaur, our SMS, now chairs a tripartite committee to implement total workplace safety and health. The third example is in the use of genetic testing to prevent adverse drug reactions. Dr. Teo Yik Ying has mapped the genomic profile of Chinese, Malay, and Indians in Singapore. Most adverse drug reactions are fairly mild, but on rare occasions, they can be severe and life-threatening in genetically susceptible subjects. Working with colleagues from Duke, NUS GMS, the NUS Department of Pharmacy, Health Sciences Authority, and clinicians from across various hospitals. The teams found that it is cost-effective to screen epileptic patients before starting carbamazepine, but not cost-effective to screen HIV patients before starting abacavir. As public health challenges grow more complex, it remains imperative for the school to work across disciplines, not just in a multidisciplinary or interdisciplinary manner, but also in a transdisciplinary approach. We need to integrate and learn to engage end users and stakeholders early in order to be able to translate our research into public health programs and policies. This stance is reflected in our school's vision. We want to be recognized for integrating knowledge across disciplines to develop solutions that will improve the health of populations in Singapore and beyond, to integrate and to influence. We need a new way of thinking. We need a new way of training in order to achieve this vision. Traditionally, we train public health specialists the same way we train specialist athletes. You are a swimmer, you are a cyclist or a runner. You are an epidemiologist, you are a biostatistician, you are a health economist, you are an occupational health specialist. But the harsh reality is that this traditional approach may not raise effective public health leaders to meet our future public health challenges. Public health specialists of the future need to be triathletes. People with the ability to apply their learning and mastery of knowledge across various disciplines. They must not only have depth of knowledge, but also breadth. They must have skills across many areas. They must be able to embrace the enrichment that comes from working across different disciplines beyond the comfort of their own specialties. We hope our school will contribute to raising such specialists. On that note, let me thank once again our guest of honor, Dr. Margaret Chan, for extending her stay just to join us this morning. Special thanks also to Dr. Amy Kaur, our SMS, for your very strong support over the last 3 years and for gracing this occasion. And thank you everyone for coming, and do enjoy the rest of the opening program, and that will include a test of what I've just lectured on. Thank you.
Thank you, Professor Chia. As a long-distance runner myself, I'll be sure to balance my running regime with some cross-training.
Next, we would like to invite Professor Tan Cho Chuan, NUS President, Chairman of NUHS Board, to deliver his opening address. Professor Tan.
Good morning, our guest of honor, Dr. Margaret Chan, our special guest, Dr. Amy Kaur, Mr. Wong Net Leong, the Chairman of NUS Board of Trustees and Trustees of NUS, my fellow colleagues, Trustees of the NUHS, our special benefactor and esteemed alumnus, Professor Swee Hock, friends, colleagues, ladies and gentlemen. I'm delighted that the Dean decided to give a lecture rather than an opening address. And to note that in NUS, power relationships are very symmetrical, because since he gave a lecture, as per our normal practice, all of you will be invited to hand in a teaching evaluation feedback form. Which, as per our normal practice, will enter his annual performance appraisal. I also warmly welcome the more than 400 guests who are kindly watching this by webcast. We encourage you to participate in the feedback form as well, because this is a school of public health, so we believe in having an adequate sample size. So thank you very much for joining us this morning. It's a very special occasion to commemorate the formal move of the Swee Hock School of Public Health into this premises in the Tahir Foundation Building. Today's event actually marks a very important milestone. In fact, we could think of it as marking 3 distinct and important milestones. First, it's a major milestone for public health in our university, in Singapore, and I dare say for our part of the world. As you heard in the Dean's opening lecture, the Swee Hock School of Public Health has a mission to turn discovery into healthier communities. And this, in fact, represents a culmination of a long tradition of seeking improvements in public health through better understanding and well-designed interventions. As we heard, in Singapore, a formalized approach to public health began with the formation of the Department of Social Medicine and Public Health, which all of us who have been here long enough fondly refer to as SMPH, before it became Cough Medicine, COFM. And this SMPH was founded in 1948. And there are people amongst us who know that in those early days, the focus was very much on the prevention of infectious diseases and on public health initiatives related to hygiene, sanitation, and education. Of course, today Singapore has become a very different place. And as we've heard very nicely from the Dean, the public health challenges we currently face are very different and require fresh thinking, new capabilities, and creative approaches, and I've learned today also transdisciplinary types of cooperation. Sometime last year I heard a wonderful talk and picked up this very useful line which goes something like this. Throughout its history, mankind has shown great ability to survive scarcity. But the question for the future is whether mankind can survive prosperity. And many of the most pressing challenges that you've seen for the future involve health conditions linked to affluent lifestyles and urbanization and to aging. And we also know that modern modes of living also contribute significantly to the emergence and spread of new types of epidemics such as SARS and H5N1. So this brings me to the second important milestone, which is that the Swee Hock School of Public Health is now well poised for a new and steep inflection point in its growth and impact. And I hope the Dean is taking note of this. The school, as you've heard, was formally set up in 2011. It's grown very nicely and has quickly established itself as an influential change agent in thinking about and tackling the challenges of our changing health landscape. The hallmark of the school is its rigor, and combined with its transdisciplinary and evidence-based approaches, and has an incredible advantage of being able to work very closely with key stakeholders, particularly the Ministry of Health and the community and our patients. And in our education, as we've heard, it's focused on training future generations of triathlete public health professionals with the necessary rigor, discipline, and transdisciplinary skill sets required for leaders who are going to be effective in managing the complex and multifaceted challenges of the future. Well, I think the school's move into these beautiful new facilities will substantially enhance its ability to expand its cutting-edge research, to enhance its education, and to nurture, attract, and to retain talented faculty and staff. In this building and its premises, the school has state-of-the-art research facilities, classrooms, and also spaces which have been specifically designed to encourage and to promote interaction and collaboration amongst the members of the school, which, as you've just heard, is coming together as a fully integrated entity for the first time. So with this, the Swee Hock School of Public Health together with NUS and the National University Health System, we have a unique and historic opportunity to make a truly meaningful contribution to health and health delivery in Singapore and far beyond. And we are together making bold plans and taking important steps to seize this opportunity to make a real impact and difference, to innovate and to lead in new approaches to health and health delivery. Last but certainly not the least, this event is also a celebration of a major milestone in philanthropy to NUS. Our university was founded 110 years ago today through very substantial donations from the community. And NUS has been very fortunate that it has continued to receive the unstinting support of visionary benefactors, donors, and friends who share our belief in the incredible power of education and research in transforming lives, uplifting society, and advancing our country. So this morning, I'd like to express our deepest appreciation to our distinguished alumnus, former faculty member, in fact, current faculty member, philanthropist and NUS board member, Professor Swee Hock. Swee Hock has actually led and supported NUS in so many different ways, but today we particularly thank him for his very generous gift, which together with the very strong support of the Ministries of Health and Education, his very generous gift enabled the establishment of the Swee Hock School of Public Health and placed the school firmly on the trajectory to excellence and leadership in public health, both regionally and globally. So Swee Hock, on behalf of the school at NUS, thank you so much indeed. All of us in NUS and NUHS will do our best to ensure that the school will live up to the high standards that your name demands. I would also like to take this opportunity to express our deep gratitude to our other benefactors, such as Dr. Tahir, whose own generous contribution to the NUS Yong Lu Lin School of Medicine will substantially boost the advancement of medical care and understanding. Finally, I would like to thank very deeply the Director General of the World Health Organization, Dr. Margaret Chan, for gracing this event as our guest of honor. Margaret, your presence here today is particularly meaningful and symbolic as an illustrious alumna of our public health program at NUS, and we are delighted to welcome you back and so grateful that you have taken the time to make this event even more special. I now therefore have great pleasure in inviting Dr. Chan to address us, and later, as you know, Dr. Chan will be delivering a lecture on the need for new paradigms as we confront the trends and challenges of healthcare in the 21st century. So with that, thank you, and please join me in welcoming Dr. Chan onto the stage. Thank you.
Dr. Amy Kaur, Mr. Wong Chit Leong, Professor Tan Cho Chuan, our most esteemed guest of honor, Professor Swee Hock, boy. And of course, you know, that is the dean of the school. He calls me Daikaje and I call him boy. So, friends and colleagues in public health, ladies and gentlemen, and as well as friends and colleagues who are connected via the broadband in Singapore, and I was told that according to Strix Time, you top the world in terms of speed. Well done. So, good morning to all of us. I have a reputation for digressing from my speech, and I need to live up to that reputation today. After the Dean's presentation, and of course, Prof. Tan Cho Chuan's remarks, I think I can go home. But seriously, Kissing, as a participant, I'm entitled to do the evaluation. According to WHO standard, you get the highest mark, which exceeds all expectation. And Prof, I hope it will go on his annual performance evaluation. From the perspective of practitioners in public health, what Prof. Chia Kee-seng shared with us this morning is the real reality. That is the reality that you need to work. I just the three words that you use to describe the interdisciplinary, I use MIT. Why? Multidisciplinary, interdisciplinary, and transdisciplinary. It's easy to remember, right? MIT. Well, Peter, I will think of one for London School. So good to see so many good friends, old friends in the audience, not only friends from Singapore, but also from afar. David Heyman is here. Prof, Chiu is here. My goodness, it is truly homecoming for me. Thank you for the invitation, and thanks for this, very warm welcome. Let me now go back to the traditional address. I have not seen my address yet, so don't be surprised. Truly, today, this is a very special occasion for the school, but for me personally. I still recall I spent my days in 84, 85 in a school in Tiong Bahru. For those of you who studied there, know that this is a world's difference from what I'm seeing today. So, Prof. Saul, thank you for your generosity and your special gift. As an alumni, I will promise you, I will make sure the dean of the school live up to his promises. And of course, Prof. Tan Chok Chuan, you're the president of this university. You too. And I'm sure I promise to give you their annual performance appraisal on a regular basis. As I said today, you're opening the Singapore's first fully dedicated school of public health in this new premises. And this is a landmark for the future of health in your communities. You are preparing this city-state to defend itself against a host of new health challenges of unprecedented complexity. You are also recognizing the capacity and the power of research and training to unravel these complexities and translate new knowledge into practical interventions and strategies. The curriculum that you are offering is on the cutting edge of science. Training, indeed. Training goes beyond the traditional areas of public health to include what I heard from you, Kee-seng, statistical genomics, and the importance of nutritional epidemiology, health promotion, and above all, research on health systems and services. As an alumni, this day and this event are tinged with nostalgia. Of course, I have already told you, Prof. Chia Kee-seng and I were classmates. And Lee Hock-sang, are you here? Yes. Hock-sang too, and many others. I still remember those days. I was the naughty person in the class. And Prof. Chia Kee-seng told you yesterday, 2 days ago, at the ministerial conference, what I did. I was also the social convener for the whole group. And as a woman, I have the special privilege to organize things without permission and just ask the boys, come along. And Chia Kee-seng, on that occasion, you missed a very wonderful trip. But coming back, it brings back very good memory. Tiong Bahru, for those of you who know the location, there is a very famous hawker store, right? Their char siu bao is the best in Singapore. And I want to thank the Ministry of Health, Constance. She brought me 2 char siu bao for tea. And I managed to share this with someone called Richard Horton, no less. Char siu bao is a special sort of bun. Inside the bun, you know, Peter Piot looks very strange, so I need to explain to him. Peter, char siu bao is a bun with roasted pork cooked in a special sauce as filling, and it's one of the best. I'll take you to this hawker stand and try it. As I said, you know, these are very fond memories that will stay forever with me. And I have benefited a great deal from the education I received in those days. And that has helped to shape me, not only in my work in Hong Kong, but beyond. Of course, I never imagined I would become the Director General of WHO. That was too far away a dream for me. But when your country asks you to serve, you have no option but to say yes. That was a very, long yes. Lasted for 10 years and 10 and a half years. It's a very strange appointment. Why? 2 terms. But, you know, if you recall, my predecessor, Dr. J.W. Lee, passed away suddenly. And the US government decided to give me an extra half a year to reward me for the hard labor that will come. I was, again, silly enough to say yes to them. But jokes aside, I was really privileged to be given the opportunity to serve public health on a different sort of a platform. And there I learned so much. And I have to tell you, I was educated in Canada, and I got my MD there. They taught me, you know, very good knowledge and skills, but what served me the best was what I learned here in Singapore. So let me take this opportunity to appreciate all of you for what you have done for me, and through you, I learned to serve the world. And I hope, you know, you are proud of me as an alumni, and I'm certainly very proud of NUS. Thank you so much. As I said, this is an important milestone. These premises and the facilities, which are cutting edge, underscore the mission of this school. And let me repeat, and that is to turn discovery into healthiest communities. Singapore already has a very good track record for doing so, but you will need to work harder given the challenges that lie ahead. Most appropriately, the school has shifted its focus, and I want to thank all the external advisors who are advising the school in their future direction. The main emphasis now is on the translation of cross-disciplinary research findings into population-level interventions, strategies, and policies. Some challenges can be anticipated. Population is aging, NCD is rising, the climate is changing, antibiotics are failing, the costs of healthcare are soaring, public expectations are also rising. So how do you deal with all these complexity? Now, chronic non-communicable disease have overtaken infectious diseases as the leading cause of health worldwide, including in Singapore here. And let me share with you an honest opinion, and this is also the opinion, the assessment done by World Economic Forum together with Harvard Business School, that these diseases will break the bank. The trends that drive these diseases, like the globalization of unhealthy food, population aging, and urbanization. These are powerful, universal, and very difficult to reverse trends that on an individual level, even at a national level, you cannot reverse them. And you have heard about the devious marketing pressure from the tobacco industry. And yesterday at our meeting on the universal health care held by the Ministry of Health, you also heard about the importance of other industry that will come into the whole picture to affect how health would be shaped in future. Given those challenges, prevention must come to the fore as never before. These are predictable challenges, but other challenges are less predictable. As we are speaking, the Ebola outbreak in West Africa, which is so tragic, demonstrates the power of volatile microbes. The microbial world will continue to deliver shocks and surprises. George Wan, when you mention H5N1, SARS, and all these diseases, I don't know why I have the distinct privilege to be dealing with all these things. And David Heyman and I work on many of them together. Right, David? Why just you and me all the time? We need to ask the question. We are destined to work together to deal with these new and emerging infections. For those of us who have been in public health long enough to realize that in the last 30 years, we see more than 30 new diseases. 70% of them are coming from the animal sector. So the ecosystem is out of balance. Animal-human interface is creating more challenge for all of us. Just imagine, there are about 5 million population here, right? In the world, you have 7 billion population. Can anybody tell me what is the population of chicken in the world? This is a public health question. Why do I say that? I just want to bring another reality in our consideration on some of these challenges. I was educated by farmers. On an average, a crop of chicken, you can sell them after raising them for about 50 to 60 days. How many days in a year? 365. Please divide that. So how many crops of chicken you can have? And don't forget, we eat the chicken, but what about those things we call chicken shit? What do the farmers do with them? How do they dispose all these waste? And how do the waste interact with the environment? As we are seeing in China, H7N9. Now, H5N1 is slightly different. You can see early warning signal because the chickens died. They were killed by the virus. But H7N9, we miss that signal. There is no early warning signal. And all these fecal matters from chicken, and for those of you who know China, chicken roam around in the environment, and all the matters, contaminate the environment. So what kind of world are we living in? Interesting world, isn't it? We do not think of the reality in life and how they impact on disease. And in the days of study, in either school or public health or in medicine, we always study in silos. You talk about modeling. I was burned several times by modeling. Modeling is good, give you a sense of where things are going. And if you recall the modeling for Ebola cases, one institute, I'm not going to name it, estimated there will be 500,000 to 1.4 million cases. And WHO's modeling, you should be proud, and it was done with one of the university in London, estimated we have about 20,000 cases by the end of 2014, which is closer to reality. Again, all these are excellent academics. Why is there such a big difference? Because of the assumption they make. Making assumptions out of the blue, detached from the reality on the ground, is something I would like to leave with you. As academics, you have access to a lot of information, but please check your information. Are they grounded in reality, in the place where people were born, live, educated, and work? Without those connections, you cannot begin to talk about translating research findings, evidence to find societal solutions. This is extremely important. As we were discussing yesterday, the ministerial meeting on universal health care not only demonstrates the complexity going forward, but also demonstrates Singapore's willingness to lead and to stand on the strength of its achievement to continue to lead. When I was working in Hong Kong, I liked to engage into very friendly, constructive competition with Singapore. And it is good for both, a very constructive competition. But it is very clear to me now, coming back this time, listening to the progress that you have made, seeing what is happening on the ground, you are leaps and bounds ahead. This is someone from Hong Kong who's speaking. And Prof. Saw, I was delighted to hear that you spent 2 years in Hong Kong. Unfortunately, those days I was away. I was studying in Canada, but it's good that you left your footprint, 2 years footprint in Hong Kong. And let me, on behalf of the school, and of course my very dear brother, Prof. Chia Kising, thank you for your generous gift. Your gift will make a huge impact on this school and in public health in Singapore, Asia, and beyond. Truly, that is the scale and the power of your generous contribution that can bring to bear to the world. What is equally important for me is the value system that is embodied in the Singapore's approach to public health. Your ability to bring people together. Why is David Heyman here and Peter Piot? Because, right, they see this country has the opportunity to leapfrog and to prevent some of the mistakes that were made in other parts of the world and be a leader in this part of the world. Now, I'm going to say something which is politically incorrect. The geopolitics, which is also an important part of our work in public health, and also the economic situation, that are all linked to public health, whether we like it or not. This part of the world would be the center of gravity in terms of geopolitics, in terms of wealth, economic development, and of course in terms of workforce ethics and values, and our values for family, for community, and for the countries. So let me once again beg you for your indulgence for digressing and not sticking to my speech and sharing with you, just in a free-flowing manner, thoughts that come to my mind. But these are very dear thoughts, and I'm so happy to be back here to share your joy in the opening of this new School of Public Health, first of its kind in Singapore. Very proud of you. Bye-bye. Thank you.
Thank you, Dr. Margaret Chan, for a very insightful speech. May we invite you to stay on stage for the launch ceremony.
May we invite Professor Lee Hin Peng and Professor Chia Ki Sing to come on stage to initiate the launch sequence. This is a kerosene projector lamp, as in you will be able to project images when you light it up with kerosene. So this is special to the school because it was given to us by WHO when the school was first started in 1948, 67 years ago.
Can I take it back?
He was given to us. Now, Professor Lee will hand the kerosene lamp to Professor Chia, and together with Dr. Margaret Chan, they will put the lamp on the base to initiate the launch sequence.
At the Swee Hock School of Public Health, we recognize the imperative for innovative approaches and novel solutions to address these pressing issues in an age of increasingly complex health, environmental, demographic, behavioral, and social challenges. The Tele rehabilitation system is one such cross-disciplinary example, combining technological and public health expertise to alleviate a situation brought about by an aging population and fewer caregivers to stroke patients who need rehabilitation.
I had to learn a bit about engineering because I need to understand the equipment that they had, the algorithms and the systems, and my engineering colleagues had to understand a little bit about medicine. If we just depended within the paradigms that are within medicine, for example, if we just depended upon existing solutions that are available right now within the field of rehabilitation, we would not have been challenged to actually come up with something that was more patient-centered, something that more met the true and real needs of patients on the ground.
Public health for the future require people who are able to integrate, who are able to bring together different disciplines. There will be a lot of interplay with what's happening in the society, what's happening in the economy of the country, and this complexity will cause public health issues to be much more difficult to tackle in the years ahead.
The school has also impacted programmatic decisions in workplace health promotion. Together with the Ministries of Manpower and Health, the school has developed the Total Workplace Safety and Health Program, which was presented at the Singapore Budget 2014 and subsequently approved, to be rolled out in select workplaces across the island. In Singapore, the school's health promotion work cuts to the heart of one of the favorite national pastimes, eating. We work with our partners on projects to empower communities to eat right and add life to their years by preventing and delaying onset of disease, particularly diabetes.
Only giving people information about what is healthy eating is not sufficient. So we changed what is being offered, or at least the Health Promotion Board changed what's being offered in the canteens and in the hawker stalls. Healthier oils, more whole grains, to make it easy for people to eat more healthily.
Beyond Singapore, the school is sharing its knowledge and expertise working with local partner institutions in Cambodia, China and Myanmar to develop capacity building programs in areas such as infectious disease management and control, workplace safety and translational research methodologies.
The Swee Hock School of Public Health has incredible skills, both within the school and more broadly across NUS that it can call upon, given its location and given its ongoing work in Myanmar. So the proximity, the skills, technical skills, but also interpersonal skills, being Asian, it's incredibly powerful.
တော့ပြည်သူ့ကျန်းမာရေးတက္ကသိုလ်ရန်ကုန်နဲ့ National University of Singapore Social School of the Public Health နှစ်ခုကပူးပေါင်းပြီးတော့ကျွန်တော်တို့ရဲ့ကျန်းမာရေးဝန်ထမ်းတွေကိုပညာရေးတိုးတက်အောင်ဆက်ပထမအနေနဲ့ဆက်လုပ်ပါတယ်ဒုတိယအဆင့်အနေနဲ့ကတော့ကျန်းမာရေးဝန်ကြီးဌာနအောက်မှာရှိတဲ့ကျန်းမာရေးပညာရှင်တွေအားလုံးကို capacity building ပေါ့နော်သူတို့ရဲ့ပညာရေးတွေမြင့်မားအောင်ဆက်လုပ်ပါတယ်
Having witnessed more advanced breast cancer cases in Asia than he did in his last 10 years working in Sweden, including the Karolinska Institute, Associate Professor Mikael Hartman knew he had to go beyond the hospital and school to reach out to the communities directly. This took him on the long ride from Singapore to Sweden to understand firsthand the unique social, cultural and community-level factors influencing health-seeking behaviors in different communities.
Being located in Singapore, there's an infrastructure to do research. And it's located on the NUS campus, allowing for multidisciplinary work. So that makes it unique. It is well resourced, it has good connections, and it has reach to the regions. And that becomes essential if you want to do public health research.
At Swee Hock School of Public Health, our educational programs, we have students from a variety of disciplines, and we actually welcome any student from any discipline to come and attend our programs. Our programs tend to be also very practical, applied and transferable so that our students can basically go out and be able to, confidently manage all sorts of public health problems in different contexts and situations.
My experience here at Swee Hock School of Public Health has been awesome. I cannot thank the school enough for giving me this opportunity, particularly the interactions with the many supervisors.
I realized that public health is quite a multifaceted issue and it encompasses a lot more. And maybe after I've graduated, I might be interested to pursue a career in public health.
I'm planning to go back to India and then I plan to work with National AIDS Control Organization. And I'm also looking at the opportunities to work with World Health Organizations, especially in infectious diseases.
Well, along the way, in terms of my clinical practice, I come across many of the challenges from the public health perspective, asking myself in terms of the skill and knowledge built up, and that also motivated me to take up the Master of Public Health with the School of Public Health.
Public health development in Singapore has really achieved great strides in Singapore. I think it is very important for us to recognize that this goes hand in hand with the socio-economic development of the country over the last few decades. And all that we have achieved so far is really put us in a very strong position as a public health example of good public health development anywhere in the world.
The Swee Hock School of Public Health remains committed to our mission of turning discovery into healthier communities. Together with our partners and the community, the school continues onwards towards integrating knowledge across disciplines to develop translational solutions that will influence and impact policies and programmatic decisions to improve the health of generations to come in Singapore, the region, and around the world.
Wow, what an inspiring video. And Wee Ming, it's true. As shared by our Dean, our Guest of Honour, and evident from this video, as we face increasingly complex public health issues, the need for all of us to work together and cross-train is becoming more apparent.
Yes, from personal experience, my work is actually on infectious disease research. And I'm a biostatistician, but I realized that knowledge about epidemiology and even microbiology, and according to Dr. Margaret Chan, I also need to understand what's on the ground so that when I do my models, I can actually, And I believe that public health research in the future will continue to be multidisciplinary. Okay.
Yes, indeed. And to hear more about what to expect in the future, join us at 10:30 when Dr. Margaret Chan will share with us her perspective on facing public health challenges in the post-2015 era, need for a new paradigm. So this is during our public health thought leadership series discussion.
We have come to the end of first part of today's program. We'd like to request that you kindly remain in your seats while Dr. Margaret Chan and accompanying distinguished guests take their leave from the theatre. Thank you very much.